Diagnosis and treatment planning in complete dentures. What is diagnosis? So, the act or process of deciding the nature of a disease condition by examination. A careful investigation of the facts to determine the nature of the thing. The determination of the nature, location, and causes of disease. So, diagnosis, according to GPT-9, the determination of the nature of the disease. Treatment plan. Developing a course of action that encompasses the ramifications and sequelae of treatment to serve the patient's need. According to GPT-9, the sequence of procedures planned for the treatment of a patient after diagnosis. Moving on to the personal data. First and foremost is the name. A social security number or a patient number is mandatory for each patient. Then the age. It is an indicator of the patient's ability to wear and to use the dentures. So, fourth decade of life, tissues heal rapidly and are relatively resilient. Beyond the fifth decade, however, tissues do not heal as rapidly, especially women facing the psychological and physiological problems of menopause. Then the sex, occupation, because certain occupational hazards can influence the diagnosis, address to communicate, and location, certain location, in the certain location, certain disease are prone. So that to be addressed. Next is the contact number. Then the chief complaint. So the concise statement like problem, condition, duration, dentist recommended return, and other factors requiring a dental encounter. A series of complaints that a patient presents with an order of severity that needs urgent attention. A subjective report must be provided by a patient in his word why the patient is seeking on oral health care. Medical history. First is the general health. A thorough and accurate medical history should be obtained from the patient. They provide important insights regarding the patient's dental prognosis, the various systemic factors to be considered during treatment planning, history of hospitalization or operation should be noted, and medication history should be made a note on it. Coming on to the personal history, diet, smoking, chewing, alcohol, and drug addiction. So this plays an important role in the maintenance of the or in the hygienic phase of the prosthesis placement. Dental history, the duration of edentulous, maxilla and mandible, reason for the tooth loss, whether the caries, it may be due to periodontal problem, trauma, and sequence that should be observed and should be obtained from the patient. Previous dentures like maxilla and mandible, how much years they are wearing, the number of teeth that is missing, the reason for replacement that should be obtained from the patient. Then the personality. The prosthetic attitude, the dentist should be able to identify the negative and positive response which can influence the treatment outcome. So according to House, he classified the personality of the patient as philosophic, exacting, hysterical, and indifferent. In this, the philosophic patient is a more accurate, more adaptive, and more easy to go with the procedures. The exacting patients, though they have some demanding expectations, but still they can be convinced to go for the treatment very easily. Thank you.